everybody. This is like murder in Roadhouse. We better not screw up. How are you? Congrats on the hats. How are you? Nice to see you. We're not talking football today. We're not here for football. Good morning, everyone.
Good morning.
As you can see, we got a fairly, hello, Governor. Nice to see you, man. I got to come over and give you If I start naming everybody, we'll be here till dinner time, so I'll be brief. But thank you all for joining us. We got a whole series of speakers, so I'm going to jump right in. It's a real pleasure to be in Camden, one of my favorite places in the entire state of New Jersey. And particularly, I'm thrilled to be here and to be back, I should say, at Cooper University Medical Center to continue the vital discussion on how we can overcome the opioid epidemic, which continues to wreak havoc on lives and families across our state. This isn't even the first event we've had at Cooper today. We just come out of, I know the First Lady was here, and a very successful discussion and summit and launch related to maternal health, which is a huge issue which cuts deeply in this state, including in particular across racial lines. And so God bless everyone associated with that. I want to thank President, I wish I could say President in a bigger sense, Kevin O'Dowd and the whole Cooper team. Thank you very much for having us, Kevin. There's a passel of elected officials, bless you all. If I start getting into names, whether they be in the legislature, from this district or elsewhere, freeholder, city council president and members, former governor, members of clergy, thank you so much, and the staff and team here, elected officials, staffs, and otherwise. Thank you so much for everything you do. It's a particular honor to be here with this lineup. We have feels like most of the cabinet with us today. Marcus Hicks, who's the acting commissioner of corrections. Dr. Sharif El-Nahal, who is the commissioner of the Department of Health. Gabir Grewal, who is our Attorney General. Carol Johnson, who is the Commissioner of Human Services. Christine Norbert Beyer, who is Department of Children and Families Commissioner. Rob Acero Angelo, a big New England Patriots fan, is the Labor Commissioner.
You know where we are?
That's not true, but I just said that. And our treasurer, former legislator Liz Moyo. Again, to everyone here today, thank you so much for coming and joining us. As I noted in my State of the State address last week, our focused and we believe strategic $100 million investment in fighting the opioid crisis is putting us in a better position to tackle this challenge. And that is, by the way, alongside of that $100 million, over a couple of years, we also have access to about $42 million of federal grants. None of us, however, and this is probably the most important thing I could say, none of us are here today to claim any sort of victory, period. The more than 3,000 lives we lost in 2018 show us how far we are from being able to do just that. Last year saw a 15% increase over 2017 in deaths. 2017 itself saw a 24% increase over 2016, and we should take very little solace just because the percentage went down. Each and every one of those are God's children, and they're gone forever. And there is a real, and some of the folks who speak after me will speak to this, there is a real unfortunate wild card at play in these numbers, and that is fentanyl. And it strikes out to me with one statistic. Over the past 4 years, so from 2014 to 2018, the amount of opioids dispensed in this state is actually down by 39%, which is a significant step in the right direction. Governor Christie, to his credit, had reduced the maximum amount of days that you could get a prescription of an opioid. That's made a real impact. But fentanyl, which is 25 times stronger than heroin and is being used to cut a whole range of narcotics and other drugs, is the big exploding scourge that we are dealing with. Not to say that the opioid side of this has gone away by any means. Our administration is taking this approach, the approach rather, that we must constantly review and reassess our efforts to make adjustments where necessary and build broader cross-agency partnerships and collaboration. I'll ask some of my colleagues in a moment here to discuss their ongoing efforts in this fight. But first, I want to announce new and additional steps that our administration will take, new weapons we are unleashing against the opioid epidemic in our state. First of all, we are removing Medicaid, something called Medicaid prior authorization requirements. So enough of you know what that means because you're applauding. For those of you watching at home who may not know what that means, it's essentially a key insurance barrier that has been gummed up inside of our Medicaid reality. So we're removing that for Medicaid, specifically for medication-assisted treatment, or MAT, and you're going to hear MAT a lot in the next number of minutes. MAT, many of you again know this because you're professionals, but if you do not, is the use of approved medications along with therapy and counseling, which has proven effective in treating substance use disorders and can help sustain an individual's recovery. It is evidence-based. This has got to be about Moneyball approaches. We need to do things that we know are working, and we know MAT works, and we have to broaden that through the Medicaid system. As I say, it is evidence-based, it's cost-effective, it allows more providers to treat more patients, and allows patients to remain in their communities, in their jobs, and with their families. Removing unnecessary barriers to MAT is the right thing both for patients and providers. I want to give a shout out, they're not here, but Lou Greenwald in the Assembly and Joe Vitale in the Senate have been leading and pounding their shoes on the table on this, and I give them a lot of credit for that. Medicaid recipients, and this is an important point, Governor McGreevey and others here know this intimately. Medicaid recipients are disproportionately impacted by this epidemic, yet they were excluded from access to MAT. The last administration did open that up, but it was for non-Medicaid covered individuals. This will now include Medicaid covered folks who get their health coverage through Medicaid. You may wonder how big a crowd that is. It's about 20% of the people in this state. But if you look at national metrics inside of this epidemic, I don't know, we don't know the numbers, but national numbers would lead you to believe it's 40% of the people who are afflicted by this scourge. Secondly, we are launching important initiatives through our Medicaid program in addition to that will continue to improve access to MAT. So on that list, we're launching an office-based addiction treatment program, which is going to create new reimbursement incentives for primary care providers to administer MAT for opioid addiction. Basically, we're putting more through Medicaid, we're putting more chum in the water to incent primary care providers to become facile and prioritize MAT for folks who are suffering an addiction disorder. And that is to the tune, by the way, of $15 million. And I think there's an ability, Carol, correct me if I'm wrong, there's an ability for the feds to come in and match some of that. The feds will come in and match that. So that's a 2-for-1 shot. This will work alongside targeted efforts by the Department of Human Services, and Carol could speak to this momentarily, beside their efforts to recruit and train primary care physicians, nurse practitioners, physician assistants to provide MAT. And that's a couple of $1 million we're going to put specifically toward that recruitment effort. Additionally, Medicaid will be building centers of excellence for opioid treatment with 2 initial locations. Number 1 in Newark through Rutgers, New Jersey Medical School, and it's not a coincidence that we're here at Cooper, right here at Cooper Medical School of Rowan University in Camden. So Kevin, to you and your team, we are really excited to work with you on this. And 2 centers of excellence, we hope we can hold these 2 locations up as models in our state. Essex County and Camden County, unfortunately, are the two number 1 and 2 counties of opioid deaths. Tragically, there's no smarter place to put these centers of excellence. There's no better medical facility or medical school in our state than Cooper. So that's an honor that we are thrilled to be here today. That's about a $4 million price tag, by the way. And finally, Sharif, effective today, right? Am I right about this? Effective literally today, through the Department of Health, opioid addiction will be added for eligibility to our medical marijuana program, as it should be. I am so far the least qualified person in this room to observe this, but just anecdotally, I think that's a big deal, both as an alternative to opioids on a going-in condition, but also as a weapon on folks who are trying to struggle their way out of an addiction. To be sure, the opioid epidemic is not a New Jersey-only crisis. It is taking a tremendous toll on communities across our nation. For the first time in history, more Americans are likely to die from an accidental overdose than an auto accident. Rich and poor, black and white, young and old, urban and rural. The fact that the top 5 counties with the largest increases in overdose deaths in 2018 are in order. This is percentage increase. Salem, Passaic, Cumberland, Mercer, and Monmouth, my home county, bears this out on a statewide scale. That's as diverse a group of 5 counties as you can assemble in this state. But as we combat the epidemic here, we hope to become, not only do we hope to break the back of this awful scourge, but we hope to become a model for other states to follow and to work with. I'm going to be at the National Governors Association meetings next month, and it's one of the few areas of common ground across all states, across both parties, where folks are just trying to figure out for the life of them what works, what doesn't work, how do we break the back of this. The people around me today and in this room are central to this mission. I thank them for their continued efforts and partnership, and I look forward to our continued work together to end this scourge. So we've got several more speakers. Please bear with us. They've all got something very meaningful to add to this discussion today and to this effort more broadly. It's now my pleasure to introduce the Commissioner of the Department of Human Services, Carol Johnson. Carol, come on down.
Thank you, Governor Murphy, for your leadership in this fight. With more than 3,000 of our fellow New Jerseyans dying from drug overdoses in the last year, we humbly hope that today's announcements mark a new chapter in the fight against an epidemic that has taken far too many people in our state and devastated far too many families. We know that medication-assisted treatment is the clinical standard for treating opioid use disorder, but people struggle to get access to this treatment. And we're never going to turn the tide of this epidemic unless we build a better and more accessible community-based outpatient treatment strategy. So under the Governor's Opioid Initiative, that's what we're going to do. And we're going all in on medication-assisted treatment to do it. So here's how. I'm going to just put a little more color on the bones for what the Governor laid out. First, we're removing barriers. We need to clear a path to success. So we're lifting Medicaid prior authorization requirements for medication-assisted treatment so that people can get treatment when they need it, and we don't lose them to care because of unnecessary delays in approval for their treatment regimen. We've been working with our Medicaid managed care plans on implementation of this policy change, and it will take effect on April 1st. This policy change will not only speed access to treatment, but it has the added benefit of lifting the burden in time and paperwork associated with prior authorization that has frustrated clinicians and that we believe has caused some to be hesitant to offer MAT. Second on our action list is recruitment. We recognize that most clinicians get very limited training about substance use disorder in medical school, and that's something medical schools in our state are trying to change. But we know that a lot of community-based providers haven't had that experience in their training. So we're going to provide the training needed to help primary care providers offer medication-assisted treatment. And third on our action list is support. Support is about helping clinicians get acclimated to providing opioid addiction treatment. To do that, we're announcing our initial 2 Medicaid Centers of Excellence in opioid treatment. As the governor said, 1 here at Cooper Medical School and 1 at Rutgers Medical School, where addiction clinical experts will provide the tools that community providers tell us they need. Things like expert support, mentorship, a place to refer complex patients. And as a sidebar, if you have ever doubted that the future is female, you need to meet Drs. Erin Zerbo and Caitlin Baston, who are the powerhouse addiction experts. Erin, do you want to stand up? They are the powerhouse addiction experts who will run these centers of excellence for us here at Cooper and at Rutgers. And the 4th action item on our list is reimbursement. We're changing the way we pay for medication-assisted treatment for opioid use disorder in Medicaid to recognize the time involved and the supports needed to help provide this care well. We're creating, as the governor mentioned, an office-based addiction treatment payment model where primary care practices will be able to bill not just for the regular office visit as they can now, but for the assessment of patients with addiction, for the initiation of medication-assisted treatment. And then they'll be able to get a bundled weekly payment while they're stabilizing someone on medication-assisted treatment. And once someone's stabilized, we'll pay them a payment bundle to support the care coordination and navigator services they need to maintain someone on medication-assisted treatment. That's particularly important for vulnerable populations, for reentry populations, for populations who need that help and support to get connected to community services. And in addition to this work to build out our outpatient treatment footprint, we're requiring all residential addiction treatment facilities that are paid by Medicaid to offer medication-assisted treatment, either directly or through affiliation agreements, so that MAT is part of residential care as well. That policy change will take effect on July 1st, which is the start of our new contract year. Altogether, we believe that by removing barriers, investing in recruitment, support, and reimbursement, we can build up our community treatment footprint and have more answers and options for family members who are struggling to find addiction treatment for their loved ones. Thank you.
Thank you, Carol. These are big, important steps. There's a big law enforcement component to this. There's a big judicial piece to this, and it's my honor to bring on up a guy who takes this extremely seriously, our Attorney General, Gurbir Grewal.
Good afternoon, everyone. I'd like to start by thanking the governor for his leadership and my fellow commissioners here for their partnership on this critically important issue. All of us here this morning know that we cannot defeat the opioid epidemic and win the fight against addiction if we don't work together strategically. So that's exactly what we've been doing. And while we've made great progress coming up with unique programs and unique partnerships, as recent data makes clear, our fight is far from over. In 2018, as has been mentioned, we lost over 3,000 lives, a record number in this state, to suspected drug overdoses, the majority of which were opioid-related. And again, if there's any good news in those horrible numbers, it's that between 2017 and 2018, we reduced the rate of overdose deaths to approximately 15%, the lowest rate of increase in almost 4 years. But from the data, we also know the reason why overdose deaths continue to climb. It's because we continue to see more and more illicit fentanyl on our streets. Fentanyl is a super potent synthetic opioid, up to 25 to 50 times more powerful than heroin. In fact, just a small amount, a quarter of a milligram dose, barely visible, can be fatal. Last year, more than 60% of the suspected heroin seized on the streets in New Jersey and tested in our labs contained fentanyl or a synthetic fentanyl analog. At the beginning of 2015, that number was only 2%. So why the increase? It's because drug dealers are cutting fentanyl, which is much cheaper than heroin, with already powerful drugs that they are peddling, to increase both their profits and the potency of their drugs. Again, all of this leads to more overdoses. So how are we attacking this crisis at the Attorney General's office? First and foremost, we're vigorously enforcing our laws, both criminal laws and civil laws. We're prosecuting criminals and bringing civil enforcement actions to hold accountable the people and the companies that have been fueling the opioid crisis and that seek to profit from addiction. Last year in New Jersey, our state police took 250 pounds of heroin or more than 5 million lethal doses off the streets. Last year, we also intercepted more than $11 million worth of fentanyl. In fact, right here in Camden, working with Chief Thompson and the Camden County Metro Police and the State Police and other partners, we put a trafficker behind bars after we caught him with more than 30 pounds of fentanyl that had been shipped from China to Camden. Enough fentanyl for 5 million lethal doses, enough to kill more than half the population of New Jersey, and enough to kill the entire population of Camden 60 times over. But our efforts can't be limited to street dealers and to traffickers. We're also going after those doctors that deal drugs instead of practicing medicine. Last year, using our civil enforcement authorities, we revoked or suspended the licenses of 18 physicians for their indiscriminate prescribing of opioids. And to date, we've filed lawsuits against 3 opioid manufacturers for their role in fueling addiction here in New Jersey. But again, it can't be enforcement alone. Through an innovative program that we call Operation Helping Hand, we're moving low-level offenders out of our criminal justice system into our treatment system. In June, we launched this program statewide in 5 counties to begin with. And 5 out of every 6 users that we touched took us up on a treatment option. And that is proof of concept. But to build on that success, in October, we partnered with the Department of Health and Commissioner Elnahal to expand this program statewide. We've given out almost $1 million for similar diversion programs in 17 counties, including right here in Camden. In the next few months, we also plan to give out almost $1 million more to high-need municipalities for what we called opioid response teams, teams of police officers, EMTs, and recovery coaches that are on call 24/7 to help people who are in crisis enter into the treatment system. And here's the final piece of our efforts. Across all of these initiatives, our strategy is being driven by data. We're taking a smart, evidence-based approach to combating this epidemic. And one of the building blocks for our efforts is our Prescription Monitoring Program, or PMP. The PMP, as many of you in this room know, tracks prescription sales of opioids in this state, as well as other drugs. So prescribers and pharmacies can be alert to drug-seeking and risky prescribing, so they can report it to authorities. And thanks to Governor Murphy, we're using funds from the $100 million he has dedicated to fighting this crisis to make the PMP an even more powerful and robust tool in the fight against addiction. Soon, we will be integrating PMP data into electronic health records, and we'll be making it easier for mental health professionals to access that database, easier for us to alert prescribers when we see evidence of overprescribing, and easier for prescribers to learn whether one of their patients has had a recent overdose. Enforcement, treatment, and recovery, all driven by data, and all central to our strategy for fighting addiction. Much remains to be done, but we are all in this fight together. Thank you.
Well done. Thank you, Gurbir. It is now my honor to bring up another leader in this fight, our Commissioner of Health, Dr. Sharif Elnahal.
I want to thank the governor for his incredible leadership in this fight against the opioid epidemic. It's clearly among his most important policy priorities, and of course, to my fellow cabinet members who all play critical roles and with whom it has been an honor to work in a coordinated team. And of course, to the critical stakeholders in this audience, many of whom are on the front lines of fighting this epidemic, both through advocacy and clinical care. You've already heard sobering statistics from the governor and my colleagues, so I'll just add a brushstroke to this picture with a couple of examples. The governor mentioned that a CDC report released just last week said that Americans now nationally are more likely to die from an opioid overdose than a car accident. And I will not mince words. This is a public health emergency. The Department of Health has been focused on this epidemic on multiple fronts. At a foundational level, we are investing in a strong data infrastructure to support a robust response. With the governor's recent investments, New Jersey will be among the only states in the nation to connect substance use clinics, hospitals, and many physician clinics to a single data network to share health information. This will improve care coordination for these high-need patients and allow for clinicians to be armed with the most complete and recent set of information, such as the last time their patient overdosed or visited the emergency room. Having your doctors and nurses know your information before treating you can be a matter of life and death, as it is for patients with opioid addiction. We are also connecting more substance use clinics to electronic health records. A recent survey showed that approximately 30% of these clinics do not have them at all, and that must change. This information will feed into our recently launched opioid dashboard that features statistics on overdose deaths, prescriptions, naloxone, hospital visits, treatment admissions, and discharge data. And this infrastructure will not only help us in government understand where we are in fighting this epidemic and how effective our programs are, but allow us to micro-target on demographic and regional hotspots where this epidemic is hitting the hardest to assess the progress of our efforts. New Jersey has also made some progress, as the governor mentioned, in reducing opioid prescriptions. But because we know that well over half of people with addiction still start with prescription opioids, we need to keep focusing on this as an important opportunity for prevention. There is still much more we can accomplish here. In 2018, 43% of individuals who received any type of prescription received a prescription opioid in New Jersey, just to give you an idea of how prevalent opioid prescribing is. Studies have found that 20% of all emergency room discharges included a prescription of opioids. As part of addressing the number of opioids given to patients, we will provide training and support to emergency room staff who assist in acute pain management. The best hospital emergency rooms in New Jersey have reduced opioid prescribing by up to 82%. We're talking about hospitals like St. Joseph's, like RWJ Barnabas hospitals, like many of them that we've seen, including the one that we're in right now, Cooper University Medical Center. Our goal is to reduce the number of opioids prescribed in all state EDs to at least 12% of patients by 2020. If this target is achieved, we will have reduced the number of people who become addicted to opioids by thousands each year. As part of an ongoing expansion to our medical marijuana program, as of today, as of the governor mentioned, opioid use disorder is a condition for which patients can get treatment with medical marijuana. Importantly, we are taking steps to ensure that these patients will also be on medication-assisted treatment, or MAT, for their addiction as part of a broad government-wide push for the most effective evidence-based treatment that we know of. And as a result, medical marijuana can be a useful adjunct in helping people bridge into recovery and perhaps even incent more individuals into seeking MAT. Previously, only individuals with opioid use disorder secondary to chronic pain were eligible for medical marijuana. Now, independently, it is yet another door that we are opening to expand compassionate use of this therapy for more patients. With 39,000 patients in the program, and the recent announcement of 6 new businesses that can proceed to the next steps in applying for a license, we are doing everything we can to expand access to this treatment to as many New Jerseyans as possible who can benefit. And I'm personally thankful for the work of Dr. Becker, the head of our medical marijuana review panel, who's been supportive in adding opioid use disorder to our list of conditions. Finally, we will also expand services to a critical piece of our infrastructure in this epidemic, which is our syringe access programs. These are safe havens for people with substance use disorder, and linking this hard-to-reach population with access to medical care, Narcan to prevent overdoses, social services and treatment, and allowing them to return used syringes and leave with new ones will expand services at all 7 of the locations throughout the state, seek to expand the number of locations, and these programs are proven public health tools that connect at-risk individuals into treatment. Those that are coming in to exchange needles can decide one day that they want to start the path to recovery, and these centers are there to help them. In closing, although we cannot eradicate this epidemic overnight, I know these tools will make strides in individuals with substance use disorder across the state, and working together, we can prevent new addictions and get more residents into recovery. Thank you. I
want to go back to, thank you for that. I want to go back. Gerbir mentioned the chief. I want to give a shout out specifically to law enforcement, first responders who are here today, and all the work you do as brothers and sisters in this fight. Amen. I'll bet Governor McGreevey is as qualified to speak to this as anyone, and that is the scourge is also in every element of our corrections reality. Both folks who are going into the system while they're in the system and as they exit the system. And in that regard, I'm honored to bring up our Acting Commissioner of Corrections, Marcus Hicks. Marcus.
Thank you, Governor, for your leadership on this issue. Thank you for making it a priority in New Jersey. From a corrections standpoint, I want to say that New Jersey is one of a handful of states that is addressing this issue from a holistic standpoint. The road to recovery in New Jersey and our state prison systems actually starts with a comprehensive assessment. We do assessments upon intake on every offender that comes into our system, and depending on what that diagnosis is, a treatment plan is actually developed, and that treatment consists of traditional behavioral therapy as well as MAT. But in addition to MAT, we also know that what's critical is that our offenders have the support necessary to continue their treatment upon release. And so we actually have engaged peer navigators. And these are folks that actually will support our offenders in the pre-release phase of their incarceration and follow them up to a year after their release and post-incarceration, because we know that that critical time for relapse is oftentimes a few days after release. So we have that in place. They help them with referrals, they make sure that they attend their appointments, and they serve as that support mechanism that they need in the community. What we've also learned, however, is that those that have been diagnosed with substance use disorder, particularly opioids, are also at higher risk for other diseases such as hepatitis C. And so under this initiative, we are actually going to be treating offenders who have both afflictions. If you're addicted to opioids, but you also have hepatitis C, this initiative will allow us to address all of those ailments inside of prison. A big part of running any correctional system is the buy-in from our correctional police officers. And so to that end, we have had to undergo a real philosophy change in working with our correctional police officers to get them to understand that this is a real issue. So we've offered training to them to raise their awareness. We've also equipped them with the tools necessary to respond and to incidents of overdose. So every correctional police officer in our state system has been equipped with Narcan, which they have actually utilized to save lives, not just within the walls, but also in their communities. And so that's an initiative that we're very, very proud of. Despite all of the steps that we've taken at the state level, we also know that our first line of defense is with our county jails and our partners. And I'm honored to have Warden Caldwell here from the County Wardens Association and Warden Taylor here from Camden County to fight with us in this epidemic. What we are planning on doing is offering $1.5 million to work with our county jails to establish a similar MAT program and get their infrastructure in place so they can work with us to fight this problem on the front lines. And in that, in addition to expanding MAT, it also includes these peer specialists that will work with the offender upon intake and, again, work with them upon release to make that warm handoff into the community with our community partners. So when we're talking about this issue, our mantra at the Department of Corrections is that we have to rehabilitate the entire person, because in the interest of public safety, if you don't reduce recidivism, and if you don't address the issues that our offenders come into our systems with, you really aren't doing everything that you can to facilitate successful reentry. And that's what we're doing. So I'm honored to have the opportunity to work with our sister agencies and our partners here to bring this to fruition. And once again, I just want to thank the governor for his leadership and having corrections as a big part of this overall strategy. Thank you.
Thank you, Marcus. The entire Children and Family Services architecture, as you can imagine, is front and center on dealing with this scourge. And I'm honored to have our commissioner with us, Christine Norbert-Beyer. Come on down, Christine.
Good afternoon, and thank you, Governor Murphy, for inviting DCF to participate in today's press conference. Through our work in the Department of Children and Families, we're all too familiar with the impact that substance abuse and dependence has on struggling families. Every day, our staff work with families in which addiction is responsible for robbing children of a meaningful relationship with their parents, families struggling to raise a teen with an addiction, or families in which a parent's addiction is placing their child in harm's way. In fact, this past weekend in my own town, we read the latest newspaper account of a mother whose drug addiction and overdose led to the death of her 13-month-old son. This kind of tragedy is heartbreaking, in particular because with the right services and supports, the outcome might have been different for both the mother and baby. While each person's pathways to substance use is different, we know that adversity in childhood increases the likelihood of substance abuse in adulthood, essentially creating a generational cycle of addiction, maltreatment, and adversity. We can and we must continue to strengthen our approaches to supporting families that are struggling with issues of dependency and substance abuse. I'm encouraged by Governor Murphy's commitment to an all-of-state government solution which leverages each department's strengths and subject matter expertise to address the many factors which contribute to New Jersey's opioid and substance abuse epidemic. In fact, Governor Murphy's investment is already having an effect, allowing New Jersey to address the opioid epidemic without the need to bring more children into foster care. By way of comparison, New Jersey's rates of foster care continues to safely decrease, while other jurisdictions across the country are reporting significant increases in foster care as a result of opioid and substance abuse crisis, with some counties reporting as much as a 200% increase. At DCF, we're particularly interested in programs which help our state's residents recover from drug dependency while ensuring that they remain connected to the family supports which will help them remain drug-free after they've completed their initial treatment. For us, addiction is a family crisis. As part of the governor's opioid initiative last year, we were able to expand our successful Keeping Families Together program, which is a model of evidence-based supportive housing for families dealing with addiction, who, without the intervention, would likely face not only homelessness, but deeper involvement in New Jersey's child welfare system. Keeping Families Together provides housing and support services to help families stay together safely while parents navigate through multiple challenges, including substance abuse, mental illness, domestic violence, and homelessness. DCF launched New Jersey's KFT pilot with the ability to serve 150 families. As a result of the governor's investment and last year's expansion of funds, as of today, 447 New Jersey families are together and housed with the support of Keeping Families Together. That's an amazing 200% increase. And when I've been around the state meeting with parents who participate in KFT, they've shared how much this program means to their family. For some, it's the most stable that their recovery has ever been. For others, it's the first time that they've been able to secure and maintain a job. For others, it's the first time that they've maintained stable housing ever. By treating substance abuse and its co-occurring factors as a family issue rather than simply treating the individual, New Jersey is able to preserve the family unit through the difficult work of recovery and provide caregivers with the single best motivation they need to overcome their addiction, their children. Additionally, Governor Murphy's opioid initiative also provides the funds needed to manage a peer recovery support specialist program in the counties with the highest rates of opioid use in the state. Peer recovery specialists work alongside child protection staff to engage and support parents who have an open child protection case and are struggling with addiction. These specialists are themselves in recovery, and because of that, can often successfully reach and support parents who are otherwise reluctant to engage with the department. KFT and the Peer Recovery Support Specialist programs augment many other supports that DCF makes available throughout the state, including services for adolescents managed through our system of care, the development plans of safe care for infants born substance exposed, and the co-location of certified alcohol and drug counselors at all of our child protection offices, and additional services for parents with child protection involvement. KFT, by all measures, is one of our great success stories in the fight against New Jersey's opioid epidemic. So I'd like to publicly thank Governor Murphy and the front office for their continued support of this valuable program. And Governor, thank you for giving so many families in the state of New Jersey the chance to stay together and overcome addiction. Thank you.
Thank you, Christine. We can't accomplish all that we need to accomplish without training and workforce development. And in that regard, it is an honor to have our Commissioner of Labor with us, Rob Acero Angelo. Rob, come on down.
Good afternoon. As we know from research, lack of employment is an impediment to long-term recovery. So I'm honored to join Governor Murphy and my colleagues today to witness the beginning of these new cooperative efforts to stem the tide of the effects of the opioid epidemic and announce our plan to help restore the dignity of work so often stymied by the effects of opioids on our community. We know people are more likely to remain in recovery long-term if they believe they can find success in the workplace and can see themselves in steady employment. Employment equates a sense of security and stability. Employment is an important social determinant of health, and employment provides dignity and respect. So today, we're announcing the new Pathways to Recovery grant in the amount of $3.9 million. This grant opportunity is designed to promote opportunities for people whose career trajectories have been negatively impacted by the opioid epidemic. These funds will allow grant recipients to provide training opportunities, supportive services, and employment to 600 people in counties that have seen astronomical increases in opioid overdoses deaths in the past 3 years. And that's right. So what do we mean by supportive services? That's job coaching, peer mentoring, child care, transportation, license restorations assistance, and clothing. All of these things go hand in hand with securing and keeping a good job. The Murphy administration wants to deepen the network of employment support for those affected by the epidemic, and this grant will improve opportunities and incentives by providing basic skills, workforce readiness instruction, and work experience focused on reentry into the workplace. I look forward to continuing the close working relationship with our colleagues at Health, the AG's office, Corrections, and all across the state to see this through. We're especially appreciative of the efforts of the Department of Human Services, Division of Mental Health and Addiction Services, who've been a crucial partner for us to design this grant opportunity. We put a link to the entire grant right on our easy-to-remember homepage. Encourage everyone to go to nj.gov/labor for more information. I just want to say that while I'm so thrilled to be here with my colleagues across the administration today, this is how we tackle all problems in the administration. We work together on a daily basis to tackle all of our issues. We all know that our employees and our grantees are out in the community all trying to do better together. And if we're working at the top to make sure that can happen, we'll have better results across the state. Thank you.
Thanks, Rob. I asked thank you, Rob, for that. I want to come back to that theme in a second. I asked the treasurer if she wanted to make any comments, and she said no, she was good. But I said I'd say something nice about her, which is that without her finding the money, none of this would happen. So, Liz, thank you. And as a former legislator, she has got a she's particularly adept at working with our legislative colleagues. I know nothing about this. I've just been told there's an active shooter situation at a one-stop in Salem County, which is why Christine and Gerbier are out trying to figure out which end is up, so keep that in your prayers. It's probably also we're going to take on-topic questions only, and if you've got something burning off topic, I know you never do, but if you do, I'm happy to figure out a way. Aliana could figure out how to follow up with you. Before I go to that, two quick comments. Rob, you also going to? Two quick comments, one of which is consistent with what Rob just alluded to. This is a very no-ego, seamless, we don't always get it right, I'm not suggesting that, but there's a cooperation across big pieces of our government that is really striking. I hope and think that that's more often than not the case for all of the challenges that we deal with. But I certainly know it is the case with the opioid epidemic scourge. So to each one of you here and those who have left and those who stand behind you, I salute you, including with experts not just in government, but around the state of all shapes and sizes. Elected officials, whether they be freeholders or in the legislature or council, certainly medical expertise, law enforcement, first responders, academics, looking at other states, best practices. We are shameless in trying to rip off ideas that may be working elsewhere. The second point, and I'm not going to name names, but I know some of you, and I know your pain and your stories, some of you in this room who have suffered through this personally and have had family members lost to this or nearly lost. And to each and every one of you, and by the way, we're all in this state together. There are 9 million of us. I've got 4 kids. We've all got families. We've got friends. We've got neighbors. We've seen this. We've seen not just the risk, not just in an abstract way, but in many cases, sadly, in a real personal way. So your lost loved ones are in our prayers, and it is for them, both in past and future, that we are doggedly pursuing this fight. Lastly, we will not stand on ceremony. You've heard a lot of phrases like evidence-based. You've heard me use the phrase Moneyball. We will not get ourselves married to one approach if the data is suggesting it's not working. So please bear with us. We believe the thrust is in the right direction. We believe that the components of this program, when added together, will give us as good a shot as we can have in this fight, but we're not too proud to change course. And if we do that, I promise you we'll let you know that. We also owe you, if we think we're staying on the right course, we will owe you updates on how we think the fight is going over time. Again, I can't thank enough the folks who are with me today who serve every single day. To each and every one of you for coming. We'll take real quickly if you've got any on-topic questions, please.
Governor, it's a two-pronged question for you and Commissioner Elnahal. A year and a
Thanks,
half
Pat.
ago, we were told that, and it sounded shocking, we couldn't have more than 3,000 deaths from opioids. Not only did we reach that figure, apparently we surpassed it.
We did.
What is the projection? What is our fear in terms of what's coming up for 2019? And secondarily, in connection with that, could you describe why we are now using medical marijuana to treat opioid use disorder? How does it work? How does it help it, and so forth?
So I'll give you a general answer, and then Sharif can come in, or anyone else up here who wants to opine. I don't know what the numbers will look like, but the wild card is fentanyl. And that is the unfortunate wild card. So this isn't really an apples-to-apples comparison. If you look at the trajectory of deaths over the past 5 years, you had an almost de minimis reality of fentanyl then, and you've got a huge reality today. So that's the wild card. I can't give you a prediction, but please God, we're trying everything we can to bend the curve. I'm a big proponent of medical marijuana being on the list of afflictions, but I'm not qualified to give you the answer. I'll ask Sharif to come up.
Thanks, Governor. So, David, as you know, the medical examiner transferred to as part of the Department of Health in the last year, and the projections that we'll be able to get for 2019, we need at least a few months of preliminary data. We actually don't even have definitive data yet for the previous year. Those are projections. But we should know how we're doing from that standpoint in the coming months. We have within medical marijuana a phenomenon where there's epidemiologic data and there's clinical data that strongly suggests that medical marijuana can help people bridge and reduce their dependence on opioids. 2 landmark studies that came out last year showed that states with medical marijuana programs had a lower overdose death rate than states that did not, and also had lower opioid prescribing. And the way that we're going to design the program here in New Jersey is to eventually require that patients who are getting it for opioid use disorder also be on medication-assisted treatment. Again, with a 2-pronged goal. Number one, we hope that it will be a useful adjunct to the treatment that we know works, which is MAT, but also we hope to incent more people to get into MAT if they feel that medical marijuana can be helpful, and to allow physicians to understand that that is an option and leverage the many options that Medicaid is providing now for more MAT. Yes?
Does it lower desire for the opioid? How does it work? Why is it effective?
Well, first of all, if you have chronic pain, it helps treat that pain. Second of all, it also helps treat a lot of mood disorder issues that someone may have associated with addiction. So we have now, for example, anxiety as a condition for which you can use medical marijuana. There's a huge overlap in mental health morbidity and addiction. So a number of those issues are thought to be helpful, in addition to just helping someone bridge off of opioids more quickly, because the MAT options are different variations. 2 of the 3 are different variations of opioids to allow someone to bridge off of their dependence.
Thank you. I want to ask, thank you for that. I want to ask the Attorney General to come up and just comment quickly on the security situation in Salem County, which is not exactly what I originally thought, but he'll give you a quick summary.
Sure. I mean, this is preliminary, and it's a little bit fluid. There was some initial reporting of an active shooter. What we have, the best information we have right now is that it's a standoff between law enforcement and a fugitive they were in the course of attempting to arrest, and there were some shots fired, but it seems to be a contained situation in the area of 172 East Broadway in Salem City, and the State Police Teams Unit is on its way there, along with other negotiators, to try to resolve that situation in a peaceful manner. There's been some reports of shots fired, but no reports of injuries. So that's just preliminary at this point. Obviously, a fluid situation, and if there are different updates, we'll share them as we get them.
Thank you,
Thanks,
sir.
Governor.
Appreciate it. Anything else on topic? Please.
Frank Jones, Recovery Reform Now, National Advocacy Organization. I have a question with regard to the distribution or the model, PCP model, to physicians. And what is the plan for the counseling on the other side, other than just the MAT? Is there a plan, because as of right now, that's not been released, that there is, to provide necessary counseling for those individuals who are going through that?
Good questions. Clearly part of it. Carol, do you want to jump in?
Thank you. That's part of the bundled payment that we intend to provide to primary care providers, is to help them get the care coordination support that will allow them to be able to connect people to those behavioral supports in the community. In addition, I would say one of the things that our subject matter experts have pointed out as we've talked about this work is the amount of office time that clinicians currently spend associated with prior authorization. We now have the ability to shift that to some of the care coordination capacity, and so not only shift those resources that way, but be able to pay in a bundled payment to be able to get some resources to primary care providers for that care coordination service to build those relationships. We're also going to use our centers of excellence to help bridge those relationships and bring together the right parties to make sure primary care providers make those connections and have those relationships.
Thank you. Any other questions before we break? Jim, do you want to say something?
I just want to say thank you, Governor, because for many
Thank you.
advocates, Carol at Harangue, this is a significant day, and these are substantial steps. So I'm just
Thank you,
very
man.
grateful. And the only thing to Doctor, would medical marijuana also be available for clients on drug court?
So
Good question.
there would be...
For those that have opioid use disorder.
Absolutely. So there would be no restriction based on that, because it's a legal program here in the state. And again, it would be an adjunct with MAT, which we hope most drug court folks have as an option.
Thank you.
Please, and then we'll break. Oh, sorry.
First of all, thank you so much. This is the first time I've had the pleasure of meeting some places with folks. And
Thank you.
live, so we're very impressed.
Do you live in New Jersey? Better yet. I just had a check.
And I voted for you.
Bless you. So did I.
You like what I have to say next.
Exactly.
So what about bricks and mortar money? This seems to be something nobody talks about. We're putting a lot of money in services, and where are we going to put the clients that could attract the retreat?
Yep.
I had a conversation at this thing. How come somebody can't get into the detox? How come they can't get into it? We have the private equity money pouring in, and it's putting the public sector funded not-for-profits at such an extreme disadvantage.
Yep.
And those people we serve are being pushed into, sometimes substandard. I run a substandard facility that I'm trying to, for 2 years, getting money to build a new one.
Yep.
It's really a struggle.
We should somehow follow. I'd love to get our team to connect with you. I don't have a good, crisp answer. I was going to say this a few minutes ago. Nobody died and went to heaven and said $100 million was the magic number here. And so,
I'd love to talk to somebody
yeah,
about
would love that.
our agencies.
Would love that.
Stories.
would love that. Maybe you, ma'am, you had something, then we're going to have to break here just because we got to.
Yeah. Good morning. First of all, thank you, Governor, and all the cabinet members for being here.
God bless you.
I'm Martha Chavis, and I'm the Executive Director of the Camden Area Health Education Center. We run the Syringe Access Program here in Kansas City, which basically serves the whole county, boots on the ground initially. And I will want to let you know, as just a comment to what we do here, not only in the city, but in the county, we have worked feverishly to have a coordinated effort of services for our people who are injecting drugs in particular. And I have been very proud of the gains that we made and the services we provide.
Great.
Part of what you mentioned in terms of providing some stabilization for those individuals once they are open to getting services in addition to what we do in terms of the syringe access program is essential. And looking forward to working with your cabinet in a more coordinated effort
Great.
to make sure that those set of services can be seamless. But I give a hand to all of us here in Camden
Amen.
for how we have networked together. And
Amen.
thank you very much for being
I did not give proper homage to the nonprofits who come to work every day and do such extraordinary work, and you represent a great example. I assume you guys, you two may want to have a little tete-a-tete, as they say. And by the way, I've said this so many times. There's a handful of communities. It's not 20, and I don't want to offend any other communities that are on the list of as they go, so goes New Jersey, and Camden is high on that list. And as it goes, as it achieves its promises, right, and its aspirations. You know, we get Camden and a few other communities to punch at their absolute God-given weight, then I think a lot of other challenges in the state fall into place. There are folks who go by one name only. There's Cher, there's Elvis. In my life in New Jersey, there's Nilsa. Happy birthday to you 2 days late. Thank you all. God bless you all. Thanks to the Cooper team for being such gracious hosts. City of Camden, Camden County, to each and every one of you, the members of the cabinet.